Hi, it's Delegate Mike McKay, District 1C, serving Allegheny and Washington counties. You're listening to my go-to source for news and insight on Maryland policy and politics, the Conduit Street Podcast.
Hello and welcome to the Conduit Street Podcast. Kevin Kinnally here with Michael Sanderson and Natasha Mehu today. Michael and Natasha, first of all, we are still social distancing. Obviously, we are still at home. We are practicing what the governor is preaching. We're staying at home, staying safe. We've all been locked up for a while. Michael, I'll ask you first. How are things holding up over there at the Sanderson home?
We're okay. You know, the kids are getting into the swing of this distance learning stuff. That seems to be going okay. We're figuring out all the routines that we're doing part of it. It's fine. It's fine.
And Natasha, how about you?
Doing good. Trying to get into a routine.
Yeah, it's not easy, of course, but MACo is certainly on top of things. You can also follow us on the Conduit Street blog. There's a ton of content going on there. I know we all have a lot of Zoom meetings and conference calls, so certainly staying busy. But today, we have been talking a lot about fiscal issues the past few weeks on this podcast and how the fiscal issues tie in with the COVID-19 pandemic. Obviously, it's a big piece of this puzzle. But Michael, I think we decided we needed to get into a health episode. And for that, we invited Natasha, who covers health policy, all health policy for MACo. And I think today we have a good outline of exactly what is happening at the state level and the local level in terms of how the state and the counties are responding to this on the health side of things.
Yeah, I think it's very timely. So thanks for joining us, Natasha.
Glad to be here.
Okay, so Natasha, let's jump right into this. I mean, what are the biggest health issues that are happening right now? I know it changes daily, but I assume most of the stuff we're talking about today is related directly to COVID-19. We know that our county folks are on the front lines when it comes to fighting this pandemic, but I know one of the big pieces of this puzzle is data, right? And I know everybody wants to get the state, quote unquote, open again. We want to get our economy back. We want people to get back to work. But how does data tie into what we're trying to do here in responding to this pandemic?
Yeah, I mean, I think you hit the nail on the head that with a lot of the COVID-related health issues, data has just been so important. I mean, whether it relates to the number of deaths, the number of cases, nursing home, testing, tracing, all of that really is tied together by data. What information do we have on our supplies, on our populations? There was a meeting of the Legislative Response Task Force to COVID-19 last week, and data was one of the points that Baltimore County Executive Johnny Olszewski brought up, and how using the Baltimore County stat and transforming that into a COVID stat just has been really helpful for all their response effort.
I mean, most counties now, I think, have their own data dashboards on their websites, right? We've seen the state do that, and we're seeing it now at the county level as well.
It definitely seems to help if your county has data in its DNA already. It makes an easier transition to thinking of this health challenge as partially a data challenge. That if you're already geared for the way we manage our public works is we spot potholes and we count numbers and we finish projects and we have we have that dashboard mentality. If that's already the way you do government, it seems like that gave you a bit of a leg up for how to handle this crisis, which is, sadly similar. It's about numbers and where geographically is the problem, where do we need our resources, what's the next thing to focus on. So anyway, I think a number of our counties are well situated to handle that.
Right. Natasha, you mentioned nursing homes, and I know that here in Maryland and across the country, we're seeing a high number of cases and deaths in nursing home, long-term care facility type homes where people live together, and obviously you have vulnerable populations there. The governor yesterday made an announcement about data in regard to nursing homes, but what did the governor say, and what else has the state been doing to try and curb these outbreaks at nursing homes across the state?
Yeah, so I think from early on, nursing homes were one of those spots where you would see these concentration of outbreaks. And we saw that for a number of reasons, where it's a high concentration of elderly people all confined together. And so the governor created strike teams that would go out when you'd have outbreaks at the facilities. And those were reaction to cases developing. But there was one thing that wasn't being released, aside from hearing in the news that, okay, this facility in this county is having a large outbreak, was the actual data on those outbreaks. So the governor did say that this week, the state will begin releasing data on coronavirus infections and deaths at the nursing homes and long-term care facilities.
Yeah, Natasha, I think you're right. There seems to be a fine balance here between privacy and also making sure that people are aware of what's going on in their communities when it does come to nursing facilities, long-term care facilities, et cetera. I remember there was a huge outbreak at a nursing facility in Carroll County that was widely publicized, but we've seen this across the state. And I remember in Washington state, there was a big outbreak at the beginning of this pandemic, and that sort of set everything off in terms of this spreading nationally. So, I mean, Michael, what do you think? I mean, the balance between privacy and releasing this data, it seems like they're trying to thread a needle here.
Threading the needle is exactly the right phrase. I mean, you have to balance a public interest with a sort of a family and community's right to know what's going on. You have to have sympathy for families who are saying, I'm worried about our family member who's in a facility and we want to know whether something's been detected at that site. That said, what do you do? Is there, is there a good way to react if it turns out, well, there was a positive test on the campus of a facility and now 300 residents are going to do what? Come back and shelter with other family members? There's no easy and obvious outcome there, I don't think.
Right. And I believe the data would really help in the long term with directing resources and assistance to the nursing homes, as well as helping to contain those outbreaks when you do have staff from the nursing homes working in multiple facilities. It's really important to have some transparency there while protecting that privacy.
And Natasha, you also mentioned race earlier on. I know that there have been a lot of calls around the state, across the state, from leaders. The governor's team has been working with state and local leaders. Why is race so important when it comes to judging how this pandemic is affecting certain races in certain areas of the state?
So what we're seeing from data is that COVID-19 disproportionately hits African Americans and minority communities, not only in Maryland, but across the nation. And I think this is really just an example of how overall, on a number of different health arenas and areas, you do see disparities when it comes to receiving treatment and being susceptible to some health issues. And so with COVID-19, it's just another example of how disparities between race really have significant impacts on the African American communities and their deaths and contracting COVID-19 cases.
I guess it's tough to sort out there whether this is an affliction that for some reason there are populations who are more sensitive to either catching it or getting serious complications from it, or whether this is just reflecting sort of health service disparities that may have been pre-existing but show up. And like the tie-in with socioeconomic issues is complicated too. This is an area where I don't think we have it totally untangled, but once you see data separated by demographic group, there's something there.
Right. And so that was one of the things Hogan had a couple of weeks ago issued an executive order that released this data, required the testing labs to share racial data. So this is one way in which we see and know this. But even before the release of that data, as you pointed out, there's socioeconomic concerns. There were underlying health concerns, as well as delays in seeking medical attention that all point to various reasons as to why, when the data was released, we were seeing this disparity. So I don't think there's just one thing you could point to, but certainly having the data is key to catching where those disparities are and rectifying them.
And I know that we've seen Prince George's County be hit particularly hard in this area. I know County Executive Alsa Brooks, with this COVID-19 work group, has been very much involved in trying to make sure that the messaging for diverse populations, whether it be economically or racially, is strong, and to get those people who are showing symptoms in the door and tested quickly. Is that what you're hearing too from the work group?
Yeah, so County Executive Alsa Brooks also presented in front of the work group last week, and that was one of the important points she raised. And they were seeing that particularly African-American men were waiting longer to seek treatment. And so that was one of the impacts of why, potentially why they're seeing higher death rates in the county and elsewhere.
It is interesting, and I think that is where all of this data ties in, and why it's so important to sort of understand why things are happening. Data is king. Another big issue that we have been following and has been in the headlines is testing and tracing, right? And this is all about the ability to test people who maybe aren't even showing symptoms. We need to know who has this virus and who doesn't, and then tracing, so that if somebody does contract the virus or someone does test positive, you can go back and see exactly where they've been, who they've been in contact with. And Natasha, you've been on top of this one as well. This is super important. We talked earlier about wanting to open up the economy. If you don't have this capability to test and trace, it's going to be really hard to do that.
Right. I think it's the one thing you hear consistently from experts is that you need to be able to test people. You need to be able to trace. And like you said, testing and tracing helps on a number of different levels. As we've been hearing, there are people that are asymptomatic, and so they're carriers, but may not know that they are carriers because they're not displaying symptoms. But testing would show that you are carrying this, even though you're not displaying symptoms, and you could infect someone else. And then with tracing, that really goes to the heart of then making sure that you can know who someone that has tested positive with has been in contact with, so that you can inform them you've been exposed, and that they could also take precautions to make sure they don't further expose more people. Just given how contagious this is, it's really important to have those two things in place before anyone anywhere can truly open up.
So this is separate from the sort of policy and political debate about, how much inconvenience and how much economic frustration there is about what we've been going through as part of the flatten the curve effort. Just as a matter of mechanics, having adequate capacity to test and to follow contacts and do the tracing that you mentioned is all part of the responsible way to get from here to a more reopened and more free-flowing economy and society and so forth. So those are like important immediate next steps.
Right. And I mean, if you don't have that ability and you start to reopen and you do start to have an uptick in hospital visits and people are being inflicted, you don't know where it's coming from. So unless you do have the test and tracing capability along with that data, it's hard, I think, to pinpoint where you're seeing surges. And we do also know, Natasha, that the state and the country is preparing for a potential second wave here too, right? So how does that play into a potential second wave that we could see maybe in the fall?
Yeah, I mean, there's so much that just changes day to day. And even in predicting the future, no one really knows. But one of the things that people are preparing for, and we haven't yet hit our peak of our surge now, is that things might die down, things may reopen, and leaders are putting in place plans for reopening, but there's that chance that in the fall, you get a second wave. And that's something that we see, for instance, with the flu, is that it comes in waves. And so certainly you'd want to have that testing and tracing in place by the fall in case there is that second wave, so that you're not put right back into this situation where you've opened everything up and then suddenly everything needs to close back down again. You want to make sure you have those supplies, those tracers, those tests.
Yeah, I think when we had the terrible Spanish flu outbreak, it was really the second wave that inflicted the most damage. But Natasha, Yumi Hogan has actually worked with Governor Hogan, and they've been able to secure some tests. Is that right? That was a big story, I think, earlier this week or late last week.
Yeah, so they were able to secure 500,000 testing kits from South Korea. So it was phenomenal work to get some testing kits into the state, because as we know, that has just been something across the board that has been lacking across the nation, is just having enough of those kits. So it was certainly a great procurement for Maryland.
The state having an active relationship with South Korea and building with an eye toward business relationship and economic development and so forth turns out to have a side dividend. I mean, we know Yumi Hogan has family, extended family in and from South Korea, and she herself speaks Korean. So that was sort of a natural bridge to build from Maryland and for this governor. But to have a side benefit like this, to find some equipment that's been really hard to find domestically, it's just, I mean, you never could have seen this benefit coming from those sort of trade and outreach missions over the last number of years. But now, boy, are we thankful for that.
And Michael, we've talked politically about this virus and the relationship between the federal government and the governors. We've heard the president say that this should really be on the governors. The governors need to get the tests. The governors need to acquire, and it's on them to make sure that this happens. Governor Hogan does that, and then there was some criticism coming again from D.C. I mean, I think that the governor really stepped out and said, okay, if the governors need to do this, this is what we're going to do. I mean, politically, this just seems like a back and forth that's never ending.
I think that's fair. I mean, we know that almost every issue, as you get close to Washington, D.C., starts to take on its red and blue tinge, and even elements of pulling America together to fight this pandemic has descended into some partisanship. I think it's nice to have that contrast here in Maryland, where our leaders at the county level, leaders in the legislature who may be in a different party from our current governor and executive branch, I mean, everybody seems to be working really well together here in Maryland. So I don't know, given the choice, I like our model a whole lot better.
No doubt. And Natasha, we've also seen some new testing sites opening up around the state. What are you hearing there?
Yeah, so there are additional testing sites being open, and that just really goes back to the fact that you need to know who is carrying the virus. So I know there are a couple of new sites in Baltimore County, big site at FedEx Field in Prince George's County, and other sites, partnerships between the counties and the state to ensure that people in their communities are able to go in and get tested.
And, mentioning earlier that you could have this second wave, we know that counties and the state are preparing for a surge. And, we haven't seen, I don't think, the peak of that yet. But when it comes to personal protective equipment, Natasha, and surge prep, how are the state and the counties working together to acquire the PPE and also prepare for a potential surge in patients at our local hospitals?
On that hospital point, so hospitals are getting expedited waivers to add additional hospital beds. So traditionally speaking, under normal circumstances, it could take months or years before hospitals receive approval to add more beds. And what the Maryland Healthcare Commission did is expedite some of those state rules and approvals for dozens of hospitals, so that overall across the state, thousands of beds can be added. I believe Hogan wanted maybe 6,000 additional beds across the state. These additional beds would really help if there is a surge and the hospital's current beds are overwhelmed and you need additional space for COVID-19 patients.
Right. We saw last week in Prince George's County, a hospital was reopened. We've seen a field hospital this week open in Baltimore City. So it seems like they are trying their best to make those beds available. And again, I think that's a good state and local partnership working together, as Michael mentioned earlier, across party lines, really in a unified response to fight this pandemic. So that's very good to see in terms of how the governor is working with all of the counties to make this happen.
Yeah, exactly. And the state had authorized, the Maryland Healthcare Commission had authorized up to 36 additional field sites. As you mentioned, Baltimore City, the convention center is one of those field hospitals. But yeah, additional sites across the state to help with the surge. And then just going along with the surge is also staffing concerns. And so in some places, you do have this buildup where you're making sure there are enough hospital beds. But just another thing to keep in mind is that you'll also need the staff there to man those beds. And I just know, my family is in New York. My mom's a nurse at a hospital in New York. And one of the things she's seeing was that as the nurses and doctors are taking care of COVID patients, they themselves also get sick. And then so you run into ensuring the need to have additional nurses that can cover when other people go down, and making sure you have the staff there to man all those beds and the surge.
Right. That's certainly a concern. And I know specifically on the Eastern Shore, they've raised concerns about the ability to handle such a surge. We know that they have limited healthcare facilities on the Eastern Shore. That's always been a contentious topic when the General Assembly is in town, but they are worried that they don't have enough people, particularly like you said, Natasha, if some of these first responders end up getting sick, where are they going to find people to fill in for them? They don't have those sort of resources where people are just on standby on the shore in some rural areas, that's for sure. All right, we'll go ahead and take a break there. When we come back, we're going to jump into behavioral health issues. We'll also talk about how the COVID-19 pandemic is impacting local jails and state prisons, all that and more after the break.
Hi, this is Brian Griffiths, the founder of Maryland Podcast Month. Maryland Podcast Month was founded in 2018 to draw attention to all of the great podcasts and podcasters here in Maryland. And during this time of social distancing, there is no better time to start learning more about locally produced podcasts. Shows like my podcast, Red Maryland Radio, Eye on Annapolis, the Conduit Street Podcast, JB's Drive-In Podcast, the Maryland Crabs, Quality Time, the Society Fringe Players, and more are still putting out fresh content. Visit MarylandPodcastMonth.com to learn more about these great Maryland podcasts. That's MarylandPodcastMonth.com. And we thank you for your support of local content.
Welcome back to the Conduit Street Podcast. Kevin Kinnally back here with Natasha Mehu and Michael Sanderson. We are focusing on health issues today on the podcast and how the COVID-19 pandemic is affecting Maryland and its health services. Natasha, I want to talk about behavioral health. Particularly when it comes to the Department of Aging. They have a great senior call program, and I really want to highlight that for a second and jump into that.
Right. So the Department of Aging has created a program where seniors can sign up to receive daily pandemic-related check-in phone calls. They'll have people that are designated, whether it's a neighbor or a caretaker, to go in and check on them if after calling 3 times, they do not get a response. Then they'll send in a designated person to check on the senior.
Yeah, and I think this has gotten national attention. They get an automated phone call every day to check on them, make sure they're doing well. And in this era of social distancing where family members may not be able to go and check in person on their relatives that may be older, I think this is a really innovative idea. And again, it is receiving national praise. And to have a designated person that can go and follow up, I mean, what a great idea. I mean, Michael, this is a great example of just technology driving policy, right? Another one we have.
But in this case, it's almost upside down. Right? I mean, we're all fascinated with technology, and we hope that
right.
These big innovative companies are going to come up with, we're hoping that the medical side is going to develop, some magic elixir that's going to wipe out the virus, that we're going to have a vaccine right away and so forth. So we're thinking in terms of the highest of technology. This is not quite the lowest, but a person making a phone call to a senior citizen who's not getting direct contact because of social distancing, This is literally like 1975 technology riding to the rescue. And okay, embrace it. That's going to work. That's fine. She'll pick up the phone and then we know she's okay today. We get a quick contact. That's actually brilliant in its simplicity.
Yeah. And then also, even on the local level, in Baltimore City, they've established a Baltimore Neighbors Network where they are engaging with neighbors to provide peer-to-peer support and check-in, but it also goes a step further. So this isn't just for seniors, but this is for people with behavioral health issues. And so it gives the peer support and check-ins an opportunity to help connect people in need with additional services. So if you do need to reach out to a therapist or a substance use provider, Baltimore Neighbors Network is being established using that old school telephone technology to get people in contact with the people they need and to check up on them.
Yeah, I imagine, and I mean, obviously mental health is pushing the envelope here when it comes to being isolated. There are a lot of people who probably need to talk to somebody and maybe don't have that resource at home. So I think everybody being locked up this long, mental health is going to be an issue. And maybe for someone that doesn't necessarily think that they have a behavioral health issue, I think it's good to have these resources available at the state and the local level. And it sounds like there are some great state and local programs that are in place right now and helping people across the state, which is very, very good to see. Another issue, Natasha, on the subject of behavioral health, I mean, everything is getting buried in the headlines unless it's directly related to COVID-19. But we can't forget that we still have a national and state and local opioid crisis, right? And that just doesn't go away when you have a pandemic like this. So how is this pandemic affecting resources for the opioid crisis? And how are we dealing with both of these at the same time?
A couple of months ago, one of the biggest health issues it's the opioid crisis. And the good news there is we're seeing some drop down, but it was still just a huge public health issue. And then now it's certainly been overshadowed by the COVID news. But as you noted, a lot of the steps taken to address the coronavirus crisis include isolation. It makes it a little bit more difficult for people to go out and get the treatment they're needed. And in many cases, people who might not have realized they have issues are self-medicating with drugs and alcohol. So it's just really important to keep in mind that there is this other public health crisis that is, still underlying there. And people still do need to ensure they have access to mental health and substance use disorder treatment.
Yeah, and I was thinking the other day about like AA and NA. I know that people go to those meetings every day in person. I was able to find out that they're actually doing it over the phone. But I think that ties right into, these sorts of things that maybe we don't think about on an everyday basis. The pandemic certainly affects everything. Nothing just stops. But when it comes to the opioid epidemic and, maybe resources are strained a bit, but it doesn't just go away. And you're right that the stress and the anxiety of being locked up, maybe not having access to those resources, not having access to your medication, certainly can cause people to self-medicate and, potentially overdose. And so that's obviously something we don't want to see happen.
This crisis just continues to reveal complexities. And I'm just overwhelmed a little bit as we think about this, first in terms of, okay, we have people in Maryland and in our community who have been exposed to this virus. Let's make sure we have the treatment they need or the hospital bed. Then you get into these issues of testing, and it's just the onion keeps having more layers, right? You keep finding, oh, wow, right, this might make our opioid problem more acute. And these issues we're going to talk about with jails. Wow, I hadn't thought about that dimension right away, but wow, that's a pressing issue. And like the senior citizens and so forth, it's very complicated, and every turn is a challenging one.
It's overwhelming. You're right. Everything is affected. And the more you start to unpeel that onion, the deeper it gets in terms of, all of these areas that are impacted and affected by this. And Michael, you mentioned jails and prisons. And Natasha, we're happy to have you here because you cover these issues for MACo. this has really been a resounding cry across the nation, of course, here in Maryland as well, is the impact of this sort of a pandemic on jail and prison populations. Obviously, you have people in a confined space. And so what is going on in Maryland when it comes to trying to curb outbreaks at our local jails and prisons? And what is the governor doing to try and address this issue as well?
In some ways, the jails and prisons are much like the nursing homes in that they're confined spaces. So certainly nationally and locally, there have been coalitions of advocacy groups, including the ACLU and the public defender, who have been urging the governor to do some compassionate release, to release people that are elderly, people who are nonviolent, people who are close to being released anyway, essentially to reduce the prison and jail populations so that you don't have it, that you have such a concentrated amount of individuals where infections can then spread very quickly.
I mean, Michael, this is obviously a controversial issue whenever you talk about releasing people who have been locked up for crimes in either jails or prisons. And it's not just controversial here, it's controversial across the nation. I mean, in your mind, when we talk about compassionate release, we talk about people who maybe are compromised and are more susceptible to this pandemic. I mean, it's a tough issue, right? And I think it's threading the needle and trying to figure out how to make this work.
I don't think there's a perfect solution that's just sitting and waiting for us to find it. I think society has always struggled with punishment versus redemption versus rehabilitation and then compassion. And it's always been an issue. People who are approaching end of life and still serving a sentence incarcerated, it's always been a question, are we serving a public person by keeping an 84-year-old person in ill health in confinement? And
right.
Those are open questions anyway. You add now the potential dimension of a physical space where the confinement itself is a potential health hazard, and the inability to engage in these, the social distancing practices and the things that can keep this contagion from spreading. If you can't do that in a prison facility or even in a county jail facility, then the human cost of having somebody incarcerated is more than we were thinking of it before. So it's not just somebody's liberty, it's also risk to themselves. At the same time, you have to worry about society. You can make judgments about who has committed a violent crime or who we think might be dangerous if put back into society. But those are not 100% assessments, and we all have to understand that. So nothing about this is easy.
Those are all really good points raised on just how difficult it is to address an issue like this. And so the advocacy groups did file cases in front of the Court of Appeals to push forward the state to make some of these changes. And Hogan's executive order, which led to early release of people within 4 months of their scheduled release and expediting their eligibility for home detention or parole, has, I think at recent count, resulted in about 2,000 people being released over the past couple of weeks on all levels of the criminal justice system.
Now, the order, though, does not apply to inmates who have been convicted of a sexual offense or inmates that are displaying symptoms of COVID-19. Is that correct?
Correct.
That's something that comes up where, we want to make sure we're not releasing violent offenders back onto the streets. But again, Michael, you mentioned earlier, it's always been a question of compassion and rehabilitation. But there are some people, I think everyone can agree, that person shouldn't be on the street. So it is a fine line, but I think the governor, working with these advocacy groups and with state leaders, they're trying to do the best that they can. And it sounds like it may be helping. Natasha, you mentioned that some people are being released, and the whole idea here is to make sure we don't have these massive outbreaks in local jails and state prisons, right?
Right. And on the local jail level, there is work being done between the prosecutors, the jails, the courts to identify those people that, again, in local jails, most people are held pre-trial or they're held for a shorter duration of time. So to identify those that can be released early. And also, as you go through the process of establishing whether someone needs to be held in the jail in the first place, because if it's a nonviolent offense, if someone's being caught trespassing, there is some ability there with the prosecutors to decide, do you hold this person? Do you release them pre-trial? And I think on a local level, a lot of those decisions are being made to determine, well, this person isn't really a threat, so they can be released pre-trial on some other sort of monitoring system so that they're not unnecessarily held in the jail.
Now, Natasha, also speaking of prisons, how are inmates in the state prisons working to help provide response for the state? I think we've seen some jobs that have been created that are really now turning into frontline folks who are really helping directly respond to this pandemic across the state.
Yeah, so in the state prisons, there are jobs that prisoners can hold, and they do get paid some hourly rate for it. And typically, these are run by Maryland Correctional Enterprises. Typically, they make stuff like furniture and flags, and some of those facilities have repurposed their programs so that the inmates are now making personal protective equipment. So they're making cloth masks and other protection equipment for correctional officers, for the prisoners themselves, and then for other state agencies.
It's very interesting. And, again, that's just an example of everybody literally trying to pitch in and help. I know another big issue is back to jails and prisons, Natasha, is juveniles. And this gets right back into Michael's comments earlier about this is a broad topic when it comes to this debate about how we should treat juveniles in the criminal justice system and whether or not we're actually rehabilitating or, what is the purpose of juveniles being there. But this is a sensitive issue, I guess, when it comes to COVID-19, right? This has also been at the forefront of advocacy groups working to address juveniles who are locked up and how this may impact them.
Right. And so with juveniles, this was a case where the Office of the Public Defender had petitioned the Maryland Court of Appeals on improvements to the conditions for the juvenile inmates. And Chief Judge Barbera had issued an order for the judges to take into consideration a number of factors before deciding whether a juvenile defendant should be detained or released. And ultimately, so far, they've had about 200 youths released, which is a third of the juvenile population. And the state has also closed a couple of facilities, given the reduction in juvenile defendants in the system.
I think it's interesting, too, when we talk about this, and Michael, I'll get your thoughts. When you are releasing folks back into society, we often hear about resources and making sure that people have resources to be successful. When you have a number of releases like this in the middle of a pandemic, it has to be difficult coordinating, making sure that these resources are available for these folks to reintegrate themselves into society. I mean, I think that's got to be something that is a difficult situation when it comes to doing this in the midst of a pandemic, particularly.
I think in the corrections business, you have a plan A, which is you set up a pre-release program. You recognize who's either going to finish a sentence or who is a candidate for some variation on early release, like Natasha just walked through, and you try and get that person some education and some contacts and some momentum that can serve them in their next phase. You don't want that person to be completely hopeless in looking for a job or looking for opportunities and so forth. So you try and ease that transition. You anticipate it and you put some time into it to make that more likely to work well. Here, if these are issues necessitated by this health crisis, you may have a series of inmates or confined people who are not really your perfect candidates to be let out because they haven't gotten that background. But you're saying, okay, we're redrawing where that dividing line is, and it's a profound challenge. I mean, I've got sympathy for every decision maker in the chain here, trying to decide how to do what's best for the incarcerated population, for those who surround for the communities who surround the facility itself, and for society at large. This is a really tricky one.
It certainly is. And speaking of that, Natasha, there was a letter that came from the House Republican caucus to the governor about this issue. And what is the Republican caucus in the House asking for here?
What they're asking for is for the governor to share more data on the inmates that they are releasing early or as a result of the pandemic. Specifically, they're looking for data on the crimes they committed and the regions in which they were released.
And again, that seems like it's a fine line between privacy and the right for people to have that information, particularly, as Michael mentioned, in the communities that surround these facilities, to know, who exactly is being released. And also, if there are victims involved, you want to make sure those people are aware as well. So it's a big undertaking. I agree with Michael that I have sympathy for everybody involved here. This is not as simple as, okay, we're going to choose A, B, and C. You all are going to leave. You have to have certain protocols in place. You have to be able to notify certain individuals. And of course, you're going to have people on both sides calling for your head when you're doing this. So it's a difficult situation to be in for sure.
Right. And there has been a long-running concern with the release of individuals from prison, given that many of those state prisons are in the more rural areas of the state. So you can imagine the concerns they have in their communities with people being released, and then also the spread of COVID-19 as people stay near the prisons rather than being released closer to home, which, again, under typical circumstances, there are release hubs and other steps that are taken before someone is released. So, that letter from the Republican caucus to the governor just really highlights their concerns with the threats to the community and potential spread of the virus.
So it's all back to the data. And we can't forget, as we record here on Tuesday, April 28th, we have an election here in Maryland today. This has also been a contentious issue in how to best handle this when we're in the midst of a pandemic. Again, everything gets affected, but we are holding a congressional election today to fill the seat vacated by the late Elijah Cummings. We have Baltimore City, Howard County, and Baltimore County voters, most of whom were sent a ballot that they could mail back in. There are limited in-person voting centers, one in each county, where people can actually show up if they need extra assistance, or if they maybe weren't an active voter on the rolls and they want to register in person on election day, they can certainly do that. But we've seen, I think, Michael and Natasha, so far from what I've seen, the in-person voting centers haven't been too busy yet. It's still in the morning here as we record, but it looks like that they do have adequate personal protective equipment. That's been an issue that's been raised by local boards of elections and the state board, but so far it seems to be okay. I mean, any thoughts? Have you all seen anything different?
I'm interested, Natasha. You're a resident of District 7. Does it feel like an election day? I mean, I know we're mostly indoors and we're not out and about as much, but does it feel at all like a day where this is happening?
No, it does feel different. I mean, I've got to say, living in the district, I had submitted my ballot as soon as it was, I received it in the mail. So I got it, filled it out, and mailed it back out, which is a lot different than I'm normally one of the people that likes to go in during early voting and go into the poll place and do it. So it does feel a lot different. It doesn't have that morning wake up and it's like I'm going to the polling place feel. It's just, all right, I did my duty and casted my ballot via mail. A little less exciting not to go into the polling place.
And Kevin, you're the policy lead for MACo on sort of administration and management of elections. And I guess we're seeing this as the trial run for the bigger picture primary in June, the mostly by mail, limited in person probably with public health consequences. Are there particular things that you're looking for from today that we hopefully can learn from?
Yeah, sure. This is definitely a trial run, whether you want to use that phrase or not. It is. We're going to send out millions of ballots for the June 2nd presidential primary. And you're right, it's mostly by mail. The governor has encouraged people to fill out that ballot. There'll be prepaid postage. They can send it back. You'll also have ballot drop boxes where people can go and drop their ballots if they need to do that. But absolutely, it is very much a trial run. I'm interested in seeing how the poll workers and how people, election judges, et cetera, once they have all these ballots and they start to canvass, which is actually tabulating the votes, how that works. Because when you're trying to do that and also maintain social distancing, it can be difficult, especially if there are challenges to ballots. You have to have multiple sets of eyes on a ballot, and how someone voted can be challenged. So I'm interested in seeing how that's going. It seems like the canvassing is going fairly well. For this special election, the governor's executive order allowed local boards to start to canvass before election, the polls closed on election day. That's typically something that they can't do. I think that was in order for them to get a jump on all of these ballots that they'd be receiving and not delay the results. So I'm very interested in how that works out. I'm also very interested to see how many people actually show up to vote in person. That's something that is really hard to predict. We're going to have at least one in-person precinct in each county on June 2nd. And it's really hard. I mean, talking to the local boards, they're having a tough time figuring out, okay, how many people are actually going to show up? We know that we want everybody to vote by mail, but we also know that people will show up in person. How do you make sure that people maintain social distancing when they're lined up, maybe outside? There are a lot of things to consider. And among the most important is making sure that you have adequate personal protective equipment for the poll workers and also for the voters. I mean, you want to keep everybody safe. Elections are not an ideal activity when you're trying to, prevent the spread of a pandemic. So hopefully everything goes well today, but certainly a lot to keep an eye on for June 2nd.
And the June primary is a broader and, more diverse palette of questions. So, we have a lot more that's before voters. Baltimore City has its principal elections, so they're on this cycle. So we'll see what happens in the aggregate. The national level stuff is maybe not all that complicated, but I'm not sure how much we will learn about in-person turnout in Baltimore City from this special general election that we can pick up and transport to a few weeks from now. So we'll keep an eye on it. I think America's doing that too, as the United States is dipping its toe into the mail, vote by mail pool. Everybody's watching Maryland here too, I think.
Absolutely agree. And we've talked about this on a previous episode. We'll link that here. We also have a lot of coverage on the blog. But Natasha, thank you so much for joining us today. We have been talking a lot about fiscal stuff, but you're the health expert. And so having your perspective here today, I think is a great pivot. And it's something that, obviously everybody's dealing with and is of super importance. So thank you so much.
Always a pleasure to be on the pod.
All right, we'll leave it there for today. As always, if you enjoy the podcast, please go ahead and subscribe. That way, all of these episodes will be sent directly to you. You can also follow us on social media, Facebook, Twitter, and of course, again, the Conduit Street blog. But for Michael and Natasha, this is Kevin signing off, and we will talk to you soon.